All right, hello and good morning, everyone. Um, Thank you so much for being here. This is the VISN 12 Mental Health Summit, how VA chaplains help all veterans in the recovery journey. Thanks so much for being here. My name is Megan Mayberry. I'm the local recovery coordinator at the Hines VA, and I'll be guiding you through today's summit. So as we gather during Mental Health Awareness Month, we're really pausing to highlight something simple but powerful, that nobody recovers alone. Recovery happens in a community with support, with people who are willing to sit with us in hard moments as well as the hopeful ones. So today's summit is really part of that commitment as it brings together veterans, family members, VA staff, VSOs, community partners, advocates all across VISN 12, all with this shared goal of promoting hope, healing, and recovery for veterans. So before we dive in, I do want to recognize the other local recovery coordinators across our facilities. They are often the behind the scenes connectors. They're coordinating recovery oriented services, lifting up veteran voices, helping to ensure that our mental health care is not just about symptom management, but also about building meaningful, self-directed lives. So if you're an LRC on this call, feel free to drop a quick hello and your facility in the chat so we can see where y'all are and joining from. And as we do that, our focus today is on a group that many people know of, but don't always know about. It's the VA Chaplains. So for the next 90 minutes, we're going to hear from chaplains and how they walk alongside veterans in their recovery journeys, supporting mental health, spiritual well-being, moral injury recovery, grief, and so much more. We're going to highlight how chaplains work as partners in mental health teams, not as a separate track, but really as part of a whole health, whole person approach to care. Couple of housekeeping items so you know what to expect as the day unfolds. Today's summit is being recorded. This is so folks that couldn't attend live today still have the benefit of listening to this presentation in the future. Second, we will have time for questions towards the end of this session. So as we go, feel free to drop your questions or comments into the chat, and we'll keep an eye on those and then circle back to them during the question and answer as we're able. Third, after this summit, you will receive an email with a link to a brief survey. If you could please take a moment to complete that. Your feedback is really helpful to shape future events and summits and make them more useful. And also in that email, you'll find an attachment with a whole bunch of resources that support veteran mental health, and then also resources on our chaplain services specifically, and your local recovery coordinator contact information. So you can follow up and continue the conversations after today as needed. So throughout this summit, I really encourage you to think about your own setting, your clinic, your team, your community, your own mental health, and how chaplains might be part of strengthening veteran recovery wherever you are. So to help us frame our time together, we're going to start with a welcome from Dr. Landreth, and he is our VISN 12 Chief Mental Health Officer. Dr. Landreth is going to be sharing his own remarks, but I do want to say that leadership is one of the biggest predictors of recovery-oriented initiatives, and that they're actually taking root. When leaders prioritize mental health and spiritual care and collaboration, it really opens the door for the kind of stuff that you're going to hear about today. So join me for a warm virtual round of applause as we welcome Dr. Landreth.
Thank you, Dr. Mayberry. I really appreciate the introduction, and I sincerely appreciate the honor to kick off the FY26 Mental Health Summit. So again, thank you for inviting me, and good morning, everyone. Good morning to the chaplains, the mental health professionals, local recovery coordinators, veterans, partners, and fellow VA leaders Welcome to this very important mental health summit. Thank you for gathering here with a shared commitment to the well-being of those who have served our nation. Today, we focus not only on advancing clinical excellence in mental health care, but we also want to recognize a vital dimension of healing that too often gets underappreciated, and that's the profound contribution of our chaplain services. As the Department of Veterans Affairs, we have a sacred obligation to care for the whole veteran, mind, body, and spirit. Chaplains are indispensable partners in fulfilling that obligation. Veterans carry unique burdens. Many have witnessed and endured experiences that challenge not only their psychological health, but their deepest sense of meaning, purpose, and moral grounding. Post-traumatic stress, moral injury, survivor's guilt, grief, and spiritual distress frequently intertwine with clinical diagnoses. Evidence and lived experience both show that when spiritual pain remains unaddressed, mental health and recovery becomes significantly more difficult. Conversely, when chaplains work hand in hand with mental health teams, veterans often report greater resilience, renewed hope, and a strong sense of wholeness. Chaplain services bring several critical strengths to our mental health mission, to include trust and access, moral injury expertise, holistic support for families, and resilience and meaning making of the veteran's experience. Collaboration between chaplains and mental health professionals is not optional. It's essential. And when we integrate spiritual care into treatment planning, we see better outcomes, higher satisfaction, and more veterans who feel truly seen and supported. This summit is an opportunity to break down any remaining silos, share best practices, and build even stronger interdisciplinary models across our VA facilities. To our chaplains here today, thank you. Your ministry of presence on the front lines of suffering, whether it's on the inpatient units, outpatient units, the vet centers, it matters more than you will ever know. You remind us that healing is not solely the absence of symptoms, but the restoration of hope, dignity, and connection. To our mental health colleagues, I urge you to lean into partnerships with your chaplain service. Invite them to your team meetings, co-create care plans, and learn from one another. Together, we can offer veterans more comprehensive, compassionate, and the most world-class mental health care possible. This summit, let this summit strengthen our resolve. Let us commit to innovative, integrated approaches that honor every facet of the veteran experience. Our veterans have given everything to serve this country. The least we can do is offer them every tool, clinical, emotional, and spiritual, available to help them heal. So again, thank you for your dedication, your service to our veterans. Today strengthens the relationship between us and chaplain services. And I have to admit that that this summit focusing on chaplain services has been a long time coming. And I just can't tell you I appreciate you and everything you do to help our veterans. So at this point, Dr. Mayberry, if you don't mind, I will hand it back to you. Thank you.
Wonderful. Thank you so much for joining us and grounding us in that perspective as we kick this off. And thank you for your ongoing support of this work. So we are joined by a really great panel of chaplains today, and they're representing different VA facilities across our VISN in a variety of programs. We have urban and rural sites, outpatient and residential settings, and a wide range of veteran needs. Today, you're going to hear about everything from moral injury groups, warrior to soulmate retreats, substance use recovery, grief and postvention work, community engagement, and more. So I'm going to briefly introduce our chaplains now, and then later you're going to hear their individual spotlights and what's happening in their VAs. So we have coming to us from Milwaukee, VA, we have Chaplain Allen. We have Chaplain Fischel from Madison, VA. We have Chaplain Inke from Lovell. We have Chaplain Schultz from Toma, Chaplain Sutterfield from Danville, and Chaplain Torres from Jesse Brown. So we are super grateful. Share this as I go. We are super grateful for the chaplain services and for you bringing all your experiences and your examples today. So to help us get started and to really get us into a space to best use this time and to understand the foundation of chaplain work, we're going to start with Chaplain Fischel.
Good morning, and thank you for inviting us to be part of this. Before we start, I'd like to take a moment and just encourage everybody to take a deep breath. Breathe in and breathe out. Just relax. Let's just take a moment and just pause and still our minds. I want to thank you again for coming and just invite you to please be open and receptive to what you will hear today. We appreciate the opportunity to come and to share. The first slide I would like to take a look at is chaplaincy is one of those things that oftentimes has a mystery around it, and people don't quite really know what are the credentials that are necessary for someone to be a chaplain. And there's a lot of misconceptions about what chaplains do. And so I kind of want to dispel some of the myths first and foremost. And also, I just want to remind you that chaplains are part of the clinical team. We're not subsidiary. We are part of the clinical team. We are trained clinically to work with all other disciplines. And it always works great when we are working in collaboration, especially with mental health and social work in all the medical fields. It just does benefit the veterans so much more. So first, I want to just kind of tell you a little difference between what is a clinical chaplain versus what is a clergy or religious leader. We are all clergy religious leaders by our training that is absolutely true. However, we have been specially trained in clinical work. And what that means is that we are trained to work and to walk along beside individuals, regardless of their religious, cultural, or social expressions. And so we meet them where they are. We go into their rooms. We get to know who they are. We meet them human to human, and we provide care according to what their needs are. We are there to help protect the veteran from proselytizing, which means forcing somebody else's views on an individual. So that is not what clinical chaplains do. We really do respect the boundaries and the space in which a veteran that we go and we encounter them. A local clergy and or religious leader is somebody who's been professionally trained as well, but they're trained in a particular religious tradition, and their focus is in that tradition. And what that means is they have a designated place of worship or an office somewhere where people come to them to inquire about their spiritual and or religious expression within the context of what that particular denomination or spirituality aspect is. And so the difference is all the chaplains here at the VA have been trained to be able to go in and, like I said, talk to anybody, anywhere, anytime about what it is that is on their heart. We don't bring our religious traditions into the room to influence them in any way, shape, or form. Another thing I want to just touch base on briefly is the difference between spirituality and religion. Now, that those words get interchanged quite a bit. We, as clinical chaplains, address by and large the spiritual nature of an individual. you hear oftentimes that people are not religious, and that is absolutely fine. But people are by and large spiritual. If you define spiritual as how one connects to themselves, to others, and then whatever it is that person calls sacred. And it's in and through that connectivity that we as clinical chaplains come and we work and we sojourn with all these wonderful individuals of varying backgrounds and various understandings. So what does it mean, or what does it take for an individual to become a chaplain in the VA? First and foremost, you have to have a theological undergirding, which means you generally have to have a Master's of Divinity degree or an equivalent educational qualification, as is evidenced by a graduate level theological degree from a university or a theological school or a college. And those institutions have to be a member of CHIA, the Council of Higher Education Accreditation, or the Association of Theological Schools, ATS. And those schools have to be recognized by the U.S. Department of Education. For individuals who do not have a Master's of Divinity degree or equivalent, an approved educational equivalency review by a nationally recognized board certification for chaplains is acceptable. Now, that's a different track, but that is one that is still a viable track, and it's still very important, as not all religious traditions require MDivs. Ecclesiastical endorsement is something that is also a mandatory. Without it, you cannot work in the VA. What this means is that it is an official statement, if you will, by the official national endorsing body of whatever faith group or denomination that chaplain is coming from, that states that that person is qualified to perform a full range of ministry required in a pluralistic setting such as the VA. If we lose our endorsement, it can lead to termination. It's absolutely paramount. I'll speak yet, that the ecclesiastical endorsement is maintained. Also, board certification is also a necessity. This is through an entity that is affiliated with BCCI or has a reciprocity agreement. So CPE is clinical pastoral education. So just as doctors and nurses and social workers and mental health providers have to go through periods of clinical training, so do chaplains. Our residency runs about a year. Majority of our chaplains have more than 4 units, but a 4-unit is a minimum. And then, of course, you have to have credible work experience as well. Now, there is an advanced level of chaplaincy, and that advanced level requires specialty certification. And what that means is an individual who is considered a senior chaplain is somebody who has demonstrated advanced practices and also has a specialized BCC where they have been able to demonstrate that they have moved beyond just what we would call the basic entry level. And so the specialty board certification is going to be in things like palliative hospice, mental health, moral injury, suicide prevention, women's veterans health, substance use disorders, and PTSD. So this means that these advanced chaplains have more education, more training, and more hands-on experience. And so they can get a little bit more deeper into the aspects of chaplaincy than let's say a GS9 who is just coming in and who is still working towards their specialty certification. Chaplains are also some of the most highly educated individuals in the hospital. One thing that most people don't know is BCCI is the granddaddy of the certifying bodies, and they require annually 50 CEUs, continuing education units, for a chaplain. And what that means is that for a year, every year, I have to go through, as well as all the other chaplains, a minimum of 50 CEUs in one way or another in order to stay current and advanced in my area of specialty or expertise. Next slide, please. So you may be asking, well, what exactly does a chaplain do? So the 4 areas that I'm going to talk about just briefly is the 4 areas are we provide spiritual care. We also provide education. We're also cultural brokers, and we also provide staff support. So within the VA chaplain, clinical chaplain, is the only individual who is authorized to perform an in-depth spiritual assessment and provide spiritual and or religious care to a veteran within the hospital. If you remember, I said we are supposed to protect veterans from proselytization. That's because we've been trained to work in this particular aspect and field. Chaplain has special training in administering spiritual assessments, helping to assess spiritual resources, their needs, and then, of course, formulating a spiritual health treatment plan for the veteran of various belief systems and non-belief systems. So this is where our education really comes into play, is because we are able to walk with a lot of different expressions. We're also highly trained in narrative literacy and competencies. One of the things that you'll notice about really good chaplains is they're very intentional with listening. So active listening is very, very important to them. And so we listen beyond just what the veteran is saying. We listen deeper. And that's really important as the person is trying to make sense of whatever is going on in their life. Chaplains address spiritual and existential pain and suffering related to many different things, such as their different diagnoses, various crises, loss, anything that they may be struggling with and they're in the hospital. We're here to help them out. We address various issues that do come up during those spiritual assessments, things such as loss and grief, despair, sadness, moral injury, abandonment. We help them explore their life review, making meaning of their life and their experiences, suffering, how to connect with themselves, with others, and with whatever it is that their sacred may be. As educators, we do exactly what I'm doing today, or what we're doing today, is we help to educate on the role of chaplaincy. What do we do? How can we help you better understand our role on the team and how we can help provide the best care possible for the veterans that we share? We also educate on religious and spiritual practices and customs. Obviously, VA policies relating to religious and spiritual expressions within the VA. We also talk and help to help people to understand what proselytizing means. We also address ethical issues. Many of us serve on the ethics team, and this is very important. We also help to discern spiritual distress and moral injury, and we help others learn how to discern that as well. The other thing that we do is we do a lot of education on the various forms of grief: anticipatory grief, traumatic grief, complicated grief, grief overload, bereavement, and mourning. We tend to use these words interchangeably, but they're all actually very different processes of grief that we happen to be going through. We also act as cultural brokers. And what that means is that we come with a bit of a cultural competence, meaning that we understand that there are many, many different versions of religious expressions. For example, if I were to ask you how many forms of Christianity are there, you may say 100 or 1,000. But in all actuality, there are more than 42,000 different expressions or experiences of Christianity across the world. 42,000. So I share that because oftentimes we lump everything together. Not everybody experiences their spirituality or their religious tradition in the exact same manner. And so it's always important that you have the person who is well trained, best qualified to be able to come in and help the person discern what it is that they need to process. The other thing that I like to think that we bring is cultural humility. And so what that means is we take great care in trying not to impose our culture or our personal values and beliefs on patients or families. And what that means is that we allow the patients and families to be the teachers because they are the experts in their own life. And so it is very important that we listen to them and that we discern and understand what that culture and their expression is. For example, oftentimes mourning or grief expression is very different depending upon what culture an individual comes from. And oftentimes that can cause conflict with staff. And so it's always beneficial when we can work together as a team to help break down what's causing this conflict. Is it a cultural difference? If it is, well, then how can we work through this? And that leads to the last piece, is bridging the cultural gap between patients, family, and staff. Is, of course, everybody is out to try to provide the best care for our veterans. And so if chaplains can help in one way to help bridge that gap, then we need to be called so that we can come along beside and everybody can be the better for it. We can all benefit. And then finally, the last thing we do is we provide staff support. And we do this through staff coming in and asking for one-on-one meetings with us, right? Because they're going through stuff too. So we're here to help them. We also help group meetings. If there's something that's going on and they need a chaplain there to help process, we do that as well. As mentioned earlier, we serve on the ethics team. Many of us are co-chiefs or chiefs of the ethics team. And so that's part of what we do. Not only do we serve and help out on the palliative care teams, but we also do the same on other IDTs. If you don't have a chaplain involved in your IDTs, I highly recommend that you invite them because they bring a different level of seeing and hearing, and it's something that is very beneficial to the team as well as for the veteran. We do debrief meetings, especially if there's been a difficult case, and the staff needs to process through what they're feeling and what they experienced. We do lots of things like coffee corners and blessing of the hands and lots of wonderful appreciation of staff. This is our way of saying thank you for what it is that you do. And of course, we also provide trauma care. If a staff member has died unexpectedly, or if there was a suicide or something that needed to go on, we're trained to also be present and help with trauma. A lot of us respond to the code blues and all the other things that go on throughout the hospital. This is just a brief summary of kind of what it is that we do. It is not an exhaustive list in any way, shape, or form, but I hope that this gives you a little bit of insight into what the education is that we bring into and we sit at the table with, and then what it is that we can provide for our veterans and for our staff alike. Thank you for your time.
Wonderful. Thank you so much, Chaplain Fischel, for that super helpful review. Hopefully folks are already starting to picture chaplains at your own facilities or areas in a little bit of a different light. As most of you can imagine, chaplains, like many of our mental health partners and providers, are doing incredibly meaningful work, often with limited time and resources. We're going to invite Chaplain Sutterfield to talk a little bit about real-world challenges that chaplains face, things like doing more with less or navigating resource constraints, collaborating with others. So Chaplain Sutterfield, the floor is yours.
Thank you very much. And thank you, Chaplain Fischel, for giving some insight to our colleagues about where chaplains come from, what we do. And thanks for the reminder, because sometimes we're so busy at the end of the day, I have no idea what I did throughout the context of an entire day. I'd like to dispel one other myth associated with chaplains. So we're going to give you a little peek behind the curtain in a sense. Challenges faced by chaplains. So we recognize we're not a special group within the VA, meaning we don't experience unique challenges. We all face these things, but oftentimes we do so with a much smaller staff and 24-hour coverage shared out across 365 days a year. So just to provide a little bit of insight here. So one of the things that we're always attempting to advocate for as we enter into a facility, we have to keep in mind every facility is different. Every VA facility has a different cultural and staff experience of what it is that chaplains do. And because of that, assumptions can be made about what chaplains do. So again, thank you to Chaplain Fischel for helping to dispel or to clarify the difference between chaplains and your normal clergy across the street. So again, we're always working against that cultural experience within the facility, helping to educate about what it is that chaplains do, who we are, and most importantly, how we can be of benefit to the veterans, but secondarily, also to our colleagues. So as we're educating, as we're building these relationships, we're always having that cost-benefit analysis conversation behind the scenes. And this is vitally important because within a healthcare system as large as ours, there are not infinite amounts of dollars. Even though, and shout out to my colleague Chaplain Green for just receiving news of a $1.98 billion contribution to the future VA or Indianapolis VA, there is limited funding. So we're always trying to advocate, helping staff understand the benefit, what it is we do, and then also what reward the facility receives for investing in that behind the scene intervention. Again, that benefits veterans, staffs, and goes beyond to supporting families even long after a veteran has died. So the reality is we're always told to do more with less. Well, the reality is we can do that and we will absolutely lose our mind. One of the reasons I was invited to talk about the challenges faced by chaplains is because for the last 2 years, we have been doing a lot more with a lot less. In fact, 50% of my staffing is non-existent right now. So I just invite you to think about that and to keep in mind, again, chaplains are providing 24-hour, 7-day a week, 365-day coverage. Imagine doing that with less than 50% of your staff. And then imagine trying to maintain your sanity. It's a good challenge. So again, one of the great opportunities in partnering with chaplains is some of us have developed the skill of long suffering, which means we've developed the ability to remain calm, even in very anxious situations. And that's something that we would desire to partner with you and extending that presence throughout the facility. So again, doing more with less. We can always do more with less, but it will wear us out. So again, learning how to practice healthy professional boundaries, making our needs known, our limitations known, making sure that directors are clearly aware of what can and cannot be accomplished, and sometimes holding the line when challenges become exceptionally burdensome. Now, as we look at how chaplains interact within the intra-service integration elements, the interdisciplinary teams, we absolutely desire to have a presence there. In fact, that's probably one of our greatest desires. However, we always have to balance that desire with assessing the benefit of being in a meeting versus taking that very limited amount of time to be with a veteran or a family at the bedside. So please know we always want to be a part of those interdisciplinary team settings, but we're always having to balance that out. And that is a great struggle. In fact, chiefs oftentimes need to provide that guidance to their chaplains to ensure that they are getting the most benefit out of their time. Again, as we enter into those service environments, one of the things we're also working against, again, are those assumptions and attitudes. When I arrived at a facility in the past, that facility had always operated in a certain way, and there was literally a closed door to chaplain participation in that. And again, investing in those relationships, because that's the opportunity. Over a number of years, we were able to nurture a new attitude towards the role of the chaplain within those teams. So that's always one of those things that we're attempting to do. Again, in that IDT setting, care plan prioritization, we absolutely recognize, the medical care of the veteran, that is the predominant piece that we're focusing on there. So chaplains are always supporting that, but at the same time, trying to offer that little bit of support that helps bring, again, that holistic element of the veterans care plan into greater focus. So we meet all of the needs of the veterans, the families. And then again, it comes down to time and access, right? Because unfortunately, another myth of the chaplains that we're not omnipresent, no matter what faith tradition we come from. So again, we're always prioritizing. So for those of you on IDT teams throughout VISN 12, please know your chaplains, they have a desire to be participatory with you. They may just not always be seen. So please invite them to engage you, even outside of those settings if you have ideals or needs. And then one of the greatest insights, again, we're going to bust another myth. Chaplains do not always get along. There's a really unique thing about chaplains, and that is that some of them are very passionate. And with passion comes sometimes a little bit of a tendency to overstep professional boundaries. And again, that comes from that instinct of serving. It's a real strength, but it's one that we also have to, as chiefs, learn to moderate and provide guidance for. So again, working with professional boundaries, that's another one of the courses I teach here, just helping to demonstrate how it is that you can maintain that passion without at the same time becoming unaware of those embedded triggers within you that are causing you to go outside of your professional context in a sense and overstep that professional line. That's one of the things that within chaplains that I have found we're always working with. And then there's a lot of competition amongst professional chaplains. I will say this from my knowledge of military chaplains, it can be pretty cutthroat, and you would not expect that. Again, we're dispelling myths. We're an extremely competitive bunch. However, when we work together within that inter-service environment, that's the goal. So we're trying to balance all those things. So just as I've mentioned briefly, some challenges faced, every challenge is an opportunity. And again, as we practice that non-anxious presence, as we demonstrate that, some would say, spiritual gift of long suffering, we're taking that challenge and we're reforming that or transforming that or reframing that into an opportunity. So again, as we look about that, we're always looking at relational development opportunities. When it comes to cost-benefit analysis, we're always looking for creative opportunities for how it is that we make known to leadership our value in new and effective ways. And if you've been in the VA long enough, you know that the way that leadership looks at metrics changes from time to time. And sometimes you have to learn how to interpret that data in a new and creative way to make your needs known. Again, we're always looking at the opportunity to afford self-care and resilience within our own service, within our own selves, and to extend that to staff across the facility. So again, every challenge we face is an opportunity. And again, most of it comes down to relational development, like we used to say in the Marine Corps, winning the hearts of minds. You know, developing those relationships is just a key thing. And unfortunately, the greatest challenge of lack of time is the inability to do that. So we ask that you be gracious with us because our desire is to do that. We just can't always do it like we'd like. The other piece I'll point out here is this idea of transformational impact. If you've ever worked with a chaplain in a very difficult situation and been struck by the impact that the chaplain had upon that veteran or upon that family, the sense of peace that maybe arose after a very difficult circumstance, I tell you, if you see that, you're not going to forget it. So that's the opportunity, again, that chaplains have to bring into that care environment. Because again, once you see it, you can't forget it. And then when it comes to the inter-service piece, we always have an opportunity for chaplains who wish to go on to become service chiefs. Man, you got a lot of opportunities for leadership development, unending opportunities. And I wanted to add this here because chaplains just don't work in the clinical setting. We partner with other service chiefs, with other supervisors. Our lessons can be things that we utilize to pass on to you so that you can develop that gift of long suffering if you are so brave to do so, but also how it is to maintain a non-anxious presence when you're in a meeting with individuals who are not always kind. That is another piece that we have the opportunity to offer to you through staff engagement. And then finally, modeling healthy conflict resolution. I know every one of our chaplains on this call has different experiences working with staff. Not all of us necessarily have developed that skill yet, but we invite you to get to know the chaplains at your facility, because if any of these challenges are something that you're facing, there's the possibility that one of the chaplains at your facility has developed the ability to pull those things off. So we're here to partner with you. So thank you.
Okay, thank you, Chaplain Sutterfield, for naming those challenges and helping us think about even how we can better support chaplaincy in our own settings. All right, so now we're going to shift to the meat of this summit, these chaplain spotlights. So these are going to be short, focused kind of glimpses of how chaplains in different VA facilities are supporting veteran mental health and recovery in different contexts. So we're going to kick this off with Chaplain Schiltz from the Toma VA. Now, Toma has a strong rural footprint, and we know that access and connection can look different in rural areas. So she's going to share how they're reaching rural veterans, as well as a bit about the Warrior to Soulmate program, which supports healing for veterans and their partners. So Chaplain Schiltz, thank you so much for being here, and go ahead with your Toma spotlight.
Thank you, Megan. So I'm going to share about Warrior to Soulmate, which is one of the pathways that the VA Chaplain Service as a whole has chosen to respond to veteran suicide. Warrior to Soulmate is a version of the Pairs Foundation Couples Workshop, and it's gone back to it was created in the 1980s, so there's a lot of data and research on it. And that data has shown that Warrior to Soulmate decreases ER visits, decreases psychological distress, strengthens family bonds, and reduces the risks of suicide, homelessness, and substance abuse in our veterans. So veterans going through relationship problems or divorce are at a higher risk of suicide. We see this in our VA, and you maybe see it in yours as well. And Warrior to Soulmate focuses on building a couple's communication skills, conflict resolution, which they term having a fair fight for change. I really appreciate that language. And emotional connection in order to ensure that couples are working together in their relationship rather than against one another. Strengthening the primary relationships and providing the skills to maintain it are crucial parts of suicide prevention, which we take part in the VA. So at Toma, we recently relaunched Warrior to Soulmate after it had to be paused during the COVID pandemic. We now have 5 trained facilitators. That's one of the requirements of the program, is that the facilitators go through a training. We have 2 chaplains, two whole health coaches, and our intimate partner violence coordinator, all trained as facilitators. And through that mix, we're going to be offering both in-person and telehealth workshops. You'll see in a couple slides ahead that Toma's in a rural area, like Megan mentioned, and the size of our catchment area means that a lot of our veterans here can't just drive over for an evening workshop or once a week. So we're testing out using VVC to ensure that all of our couples who want to experience Warrior to Soulmate have that opportunity. And for our in-person workshops, we have luckily partnered with a local retreat center, and that site has beautiful grounds that the veterans can kind of walk around in. It's got meeting spaces and rooms attached within the retreat center designed for quiet and connection. For a future program, we're also looking at hosting one at our local Army Reserve installation, Fort McCoy in Sparta, Wisconsin next year. So just an example of looking at what exists within your local community that you can utilize to help support your programs and your veterans. So far here in Toma, we've only hosted 1 retreat, and it was in person at that center. But in our first batch of feedback forms from our very first retreat, it was written by one of the participants, "I believe this retreat saved my marriage." So we already have this concrete feedback that we're providing skills that veterans and their partners can use. And that couple continues to connect with our chaplain service and is using the skills we've provided regularly. You can go to the next slide, please. So this slide shows a couple. Oh, we're not there yet, it looks like. The next slide shows a couple of the curriculum components from Warrior to Soulmate. It highlights the relationship skills that are focused on and the outcomes of the program. I shared a lot of these skills and outcomes already, but the program is held using PowerPoint slides, and these are 2 of those actual slides for the program. And it goes through kind of the training of the facilitators, that there are 15 concrete relationship building skills that the veterans are provided with, that the program has been going on for 35 years, It's research driven. It's an experiential model where the couples are taught a skill and then they step aside and they practice using that skill. Then they come back to the large group and share how it went. But again, these are just examples of what the program looks like for you. So next slide, please. So as I mentioned in my conversation about Warrior to Soulmate, our chaplain service has had to integrate telehealth to really meet the needs of the veterans we serve, especially those in northern Wisconsin who can deal with copious amounts of snow and ice and just can't drive down for a visit. So we offer VVC for all of our outpatient consults through our chaplain service. This includes doing our initial spiritual assessments, our 2 moral injury groups that we offer, and our grief groups are all either offered in a hybrid format or there are offerings just through VVC for those veterans. This has allowed us to bring veterans into our groups and our ministry actually from across our VISN. So your VA, if you're not part of the Toma VA, may actually be sending veterans to some of our groups that are run by VVC. We get referrals from VAs, for example, that don't have a VVC moral injury group, but there's a veteran who could use it that needs that care from their home because they're maybe homebound or they're not within driving distance of their VA, and we welcome these referrals from outside of Toma. We have had veterans from as far as the Upper Peninsula to northern Minnesota, and even some who travel over the road and appreciate the freedom to just pull over and sign in from where they are. Another aspect of our rural ministry is that Toma VA is unique in that we are primarily a CLC VA, and our veterans, a lot of our veterans that live here don't have family and friends close by who can easily come and visit them. They might be living out their lives 3 or 4 hours from home. And this makes our role as chaplains especially important as care companions for them. We provide an interpersonal connection, regularly checking in on how their lives are going, and that pastoral connection for those who have moved away from their home church. We remind our veterans, especially those who aren't visited, that they remain valuable members of our community and our nation as they live out their lives within our walls. So that's one of the ministries that's our honor here at Toma VA as a rural center. All right, I'm going to pass it back to Megan. Thank you so much for your time.
Wonderful. Thank you so much. So next we are going to head to Chicago at the Jesse Brown VA with Chaplain Torres. In Chicago, chaplains are involved in postvention efforts, and he's going to highlight how chaplains help people process grief, make meaning, and stay connected to care. So please welcome me in joining Chaplain Torres to share the Jesse Brown Chicago Spotlight.
Thank you and good morning, everyone. I'm Chaplain Jose Torres, Chief of Chaplain here at Jesse Brown VA. I would like to share about our chaplains collaboration with the Bridge team, which is a critical incident response program for employees. Our facility continuously promotes the Employee Assistance Program, or EAP. However, there are times in which assistance is needed before employees might be connected with EAP. With that in mind, the Bridge team was created. It stands for Building Resilience, Incidents Debriefing, and Guiding Employees. It functions as a one-stop shop to access free, confidential peer support services following a critical incident, adverse event, or other acute stress. As I mentioned a moment ago, the primary purpose is to bridge the gap between traumatic workplaces events and the provision of EAP services. The Bridge team usually responds within 1 business day, and in most cases within hours, to connect individuals and teams to the appropriate responders. Very importantly, participation is completely voluntary. And next slide, please. So, as I said, this is an interdisciplinary team that is composed of subject matter experts, including the chaplains, employee health, code lavender, organizational development, physician peer support, suicide prevention, trauma-informed second victim support program, and workplace violence prevention. From the chaplain's perspective, let's say in case of an employee dies and all other coworkers are impacted by that, we emphasize that we are available to provide support as desired or as needed. We usually communicate with the service chief or the supervisors in those instances as a first step to identify needs. That might include stopping by the unit and see staff as they're available, or there could be perhaps a dedicated time where all impacted staff is present for a 10, 15, 30-minute gathering, an opportunity to share and process feelings. And we do also that in collaboration with the bridge team. In those cases, oftentimes they come and join us for those moments. Individual support can also be offered and take place afterwards. Every unit, every situation, every context is different, but we try our best to adjust based on the needs. And very importantly, we remind employees of the importance of EAP. And we're very grateful for this partnership, and we have witnessed the countless times in which employees have been positively impacted by this important program. Thank you.
Thank you, Chaplain Torres, for that look at how chaplains can walk with people in the wake of loss and how those bridge programs can keep people connected. Thank you. All right, so our next spotlight is going to bring us back to Chaplain Sutterfield at the Danville VA. And this time we're going to zoom in on chaplain involvement in substance use programs and how spiritual care and recovery can work together to promote long-term recovery. So Chaplain Sutterfield, the virtual floor is yours.
Thank you very much, and I welcome you to advance that slide there. So VA Ileana has we're fairly fortunate. We're in a rural area. However, we're not far from Indianapolis. So we serve as a kind of a go-to place at times for services that not all of the other facilities can provide. Because unfortunately, we can't provide everything everywhere. So VA Ileana really has been fortunate with our CLCs. But today we're going to look at the substance abuse program, mental health integration, because that's really where we've been focusing a lot over the past couple of years. So at this time, VA Ileana is fully integrated within our substance abuse program. And we're able to do that despite the fact, again, that we have a very small staff. We've prioritized that clinical area because that clinical area has an impact both in the inpatient setting and then the outpatient setting as well. And that environment of care provides us an introductory opportunity to veterans that can extend for years after their discharge. And again, that helps us as we reach out into that rural environment that we're surrounded by. So again, full integration, providing individual spiritual support, assessments, pastoral care, group interactions. There was a time that we were offering 5 different groups on that unit. Most recently, we've launched another group on Sundays, just again to allow the veterans additional opportunities throughout that 7-day week to be active participants in their own recovery. And then again, this service in this environment leads extremely well into family opportunities, warrior to soulmate, as has been discussed. So again, being fully integrated there allows us an avenue into long-term care relationships with veterans across our entire catchment area. And that brings us into that element in which we are attempting, and it's been very challenging since COVID. I'm surprised, even this long, we're still trying desperately to integrate into the community. One of the things that chaplains have the ability to do is work with each veteran to look at their home area, identify local recovery communities, and if the veteran's interested, faith-based communities that would potentially appeal to the veteran and potentially meet their needs. So we're able to assist them in developing that plan before they leave so that they have that plan in place, so that they have that meeting in that location and that time to potentially choose to go to if they so choose. The other big piece is that in that integration, we've expanded that into our suicide prevention and post-vention programs, because again, all these things connect. We provide care to all of the veterans who are on our active flag suicide prevention list. So we're constantly reaching out to them. But in addition to that, we've expanded that to provide an additional year of support to veterans who have come off that active flag list. And we continue to partner with those interested veterans outside of the suicide prevention team, again, just keeping that pathway and that door open. So we can probably already begin to see some of the benefits of this integration. And again, that's going to be focusing on that inpatient side of, resilience. This partnership here, again, it helps to take the load off of some of the team members who have been working in these high stress environments, because they know that they also have us to support them. But it also, at the same time, as a chaplain's involved in these areas, well, it helps staff that when they become tired or maybe a little jaded or maybe come in and a little bit grumpy because they're working with addicts again, to help maintain that sense of compassion and empathy, because that is very easy to lose track of in this environment of care. So the chaplains bring that reminder to practice that compassion and that empathy. That's an absolute benefit of our integration there. With community partnerships, again, we're identifying those supportive relationships. We're building that sense of community, and that is a long game effort. We're also in that process, connecting veterans to these different potential resources. We're inviting those veterans to reconsider their willingness to trust in not just individuals, but also institutions that many have lost trust in over the years. So again, we are reintroducing them to environments that were potentially in the past, most often in the past, very meaningful to them, but because of some reason they have stepped away from. We are inviting them to, again, reconsider their willingness to risk trusting such institutions and environments. And in doing that, we're also helping them to identify what brings them meaning and purpose in life. We're empowering them to focus on that, to identify that, and to not allow the hurts, habits, and hangups of life to derail them from what brings them meaning and purpose. So again, we're working actively with suicide prevention and post-vention. And as I mentioned, the Warrior to Soulmate piece is extremely helpful there, because when we bring families together, veterans, significant others, and we help them to communicate in some healthier ways, we really can see powerful transitions. And then, of course, we're always providing that ongoing assessment of spiritual and emotional needs. With that post-vention piece, if we're able to identify that, then we're able to alert the team when needs are arising. We're able to encourage the veterans to indicate that they have those needs before they get to the point that they're overwhelmed by them. And of course, we're adding moral and emotional support. Next slide, please. So VA Ileana, as I mentioned, it's a kind of a unique place, right on the state line of Illinois and Indiana. And we provide services to 34 counties in central Illinois, as well as areas of west central Indiana. So again, we're really spread out. We've, of course, got the medical center in Danville, which is one of the original national homes for disabled volunteer soldiers, established in 1898. So we've been doing it for a while. But then we're expanding into the community-based outpatient clinics in Bloomington, Peoria, Decatur, Mattoon, Springfield, and soon to be Champaign-Urbana. We also support the vet centers in Peoria and Springfield, mostly providing educational resources to staff there, but also partnerships that we can engage based upon their assessment of needs of veterans in their area. So we're entirely open to going out to those vet centers and doing different services in partnership with them. As it comes to our expanding service, and again, this is where we really make a lot of our butter, is in the outpatient consultation area. Again, addiction, moral injury, grief, a lot of grief, meaning and purpose, caregiver support, we're actively involved with them. Again, Warrior to Soulmate, I'm going to keep hammering that one. And then another piece, the establishment of collateral medical records. Just like with caregiver support, we have the ability to do that. And it's vital, especially when our veterans age. If we have those collateral medical records in place prior to a veteran's death, then chaplains are easily able to continue to provide services to the veteran's next of kin, while at the same time ensuring that we can capture that workload, while at the same time we can keep showing to leadership the benefit of us providing that support. That's a great PR piece right there if you want to nail that one to the wall. And then finally, environments of care. Of course, we've got the Veterans Video Connect, face-to-face group settings. And then I'm hoping, again, we have some major staffing challenges, but I'm very hopeful that we'll be able to step into the home-based primary care environment in the very near future. And then finally, we've got our community clergy training program, which is a resource provided to community partners, providing knowledge, resources, points of contact within the VA to help rural clergy and their supportive relationships to know how it is that the VA not just functions in the big picture, but how it's active in their community and who it is that they can go to in times of need. So thank you very much.
Wonderful. Thank you, Chaplain Sutterfield, for highlighting both the role chaplains play alongside substance use treatment, facilitating empathy, and integrating services in these rural kind of expansive areas. All right, so we are going to return to Chaplain Fischel, who kicked us off here today at the Madison VA. And this spotlight's going to focus on outpatient work around moral injury, as well as programming for women veterans. So moral injury really can touch on values, identity, spirituality, and chaplains are uniquely positioned to support veterans as they wrestle with a lot of those questions. And Chaplain Fischel will also share how chaplains tailor their care to meet the needs of women veterans. So thank you for being here, and go ahead with the Madison Spotlight.
Great, thank you. So the three areas, as she shared, that I'm going to focus on is moral injury, our outpatient clinics, and then women veteran care. So moral injury care has been provided here for over 15 years at the Madison VA. For about 10 years, maybe a little bit longer, it's been co-facilitated between mental health and chaplaincy. The group itself is known as a combat zone related moral injury group, and we offer 2 to 3 iterations each year, each iteration running 12 weeks, and they are 2-hour closed sessions. Each individual that is interested must be connected to mental health, and I screen each and every veteran before to help ascertain whether the group would be a great fit for them or not. Otherwise, we can do some one-on-one work until they feel they are ready for the group participation thing. Back in 2019, we were one of 7 VA sites with a moral injury group that was selected to be part of the Dynamic Diffusion Network inaugural year. We were really proud of that, and we really enjoyed that. And we are currently part of the second phase of the DDN. The DDN has grown quite extensively, and so looking forward to that continued process as we discern what's best for our veterans. I'm also currently working on developing phase 2 of our combat zone related moral injury, and that is in order to get into that particular group, you obviously have to complete phase 1, and phase 2 will do more of a deep dive into the existential aspects of moral injury and learning perhaps at a little deeper level on how one can live through those experiences. And one thing that I am very, very proud of here at the Madison VA, I've been up here, I'm going on 12 years, is the collaboration that has taken place between mental health, social work, and chaplaincy has been like amazing. And I couldn't ask for a better site that exhibits collaboration and teamwork, both inpatient and outpatient. Next slide, please. The other thing I'm really proud of what we do up here is we have a very robust outpatient clinic covering all different kinds of things: grief and bereavement, moral injury, mental health, women's health issues, spirituality, religious, existential concerns, substance abuse, suicide prevention, and postventions, and so much more. Our clinics are generally full. We have 4 specialized chaplains, 2 with specialty certification in mental health, 1 in women veteran care, and 1 in hospice palliative. They all do inpatient, outpatient, but they also do group work within their given population. Again, can't say enough about the collaboration piece. I think that's very important. And then the women's veteran care is something that's fairly new. We've started that about 3.5 years ago. We have Chaplain D. Hart, who came on board around that time. And I asked her to put together a program for our women veterans, as many of them felt unseen and unheard and awfully isolated. And she was able to develop an amazing program. And so currently we have 3 spirituality women's groups. She provides individual care, and the groups are in high demand. Her attrition rate is very low. I think in the entire time that she's been doing it, only 3 veterans have actually dropped out. Because of various reasons, not necessarily because of the group, but because of conflict of time. One of the big successes with this particular program is these women have felt that they have developed a strong trust with chaplain service, and through that trust and through us being able to get them together with other female veterans, they have formed an amazing community where they check in on each other and they provide care. And I'm so impressed and so pleased. Of course, we've got a steady increase in the number of women veterans that we are serving. The groups have turned into jumping off points for our women veterans, where they have begun to engage in other services, such as other groups with mental health, MST groups, and then, of course, peer support groups as well. One of the things that we're also proud of is where women were once isolated, they now have become connected and are helping other women to feel connected and to become more involved in their lives. And so I'm really, really happy with that. And again, going back to the collaboration, I am so pleased to be up here in the Madison. I could talk to you about a lot of the programs, palliative hospice. We do a lot of really amazing work up here. I'm so proud of my chaplain staff, and I love the fact that we work so well with the other groups, with the other service lines. And my goal is that we continue to push on, push up, so that our veterans continue to receive the best possible care as they deserve it. Thank you for your time.
Wonderful. Thank you so much for sharing all the successes you've had and your energy and passion for what you do there. Really, really great. All right, our next spotlight takes us to Lovell with Chaplain Inke. Lovell is unique in that it's an integrated facility. So essentially it's VHA, the hospital, and DOD, the Department of Defense. So what that means is that they are working with recruits, active duty members, as well as veterans who are all experiencing a wide range of mental health challenges. So today, Chaplain Inke will share some practical strategies to cultivate gratitude and resilience. So welcome.
Thank you, everybody. Thank you for my chaplains who have gone before me. They laid the proper ground for me. Now, at the level, as mentioned, we are very proud of the integration between the VA and the Department of Defense. So we serve almost 3 entities. We serve the boot camp, that's the recruits. We serve the active duty, who are at the base, and we serve the veterans and their family or dependents. So I'm going to talk about especially what we do well, and how we do it, the impact and the outcome. So the first thing we do, we create a really customer experience. That's why you see the word welcome is just not a word. It's a statement that we use every time to make veterans or our stakeholders come back for their treatment, because everyone needs to be appreciated and everyone needs to be welcomed. And that's why that welcome starts by the word. I really appreciate Chaplain Faisal when she asked us to pause and to relax. That's the first thing we do when our stakeholders come in our facility. We don't ask them, what's wrong with you today? That was already clinical diagnosis. They came to the hospital, they're sick, they're depressed, they're anxious, they are suffering with the PTSD, they are dealing with the alcohol and addiction. So as chaplain, our presence is to ask them, how is your day going today? So Chaplain Faisal, thank you for allowing us to pause, because sometimes the days are so busy. So that's something that we integrate very well with the customer service advocate, so that patient come back to our facility. And when you come to our facility, our mission is, say, raiding the warriors. Warriors are the active duty and caring for the heroes. While for our chaplain services, you see my title is Accompanying the Journey of Hope, Healing, and Recovery. That's purely our role. Because at this place, with the military, you have to stay on your lane. And we have been so well working with all caregivers because we stay on our lane. We keep our lane by following what we need to do as chaplain. So welcome. When they come, we know that they are already given themselves permission for care. They have already decided that we'll be part of their plan in their care treatment. So secondly, you realize that after welcoming them, we make them feel at peace. And then we come to understanding that, as Dr. said in his open remarks, that healing is not only symptom reduction. We make mental health treatment is essential. Spiritual care helps veterans reconnect with meaning, dignity, and hope. And how do we do that? At our ATP program here, we are part of the treatment plan. So when they finish their 8 weeks of treatment care here, there's always what they have asked to do after care. And that's why you heard some of us chaplains talk about the community engagement. So we give them that opportunity and they come to us. We connect them with the clergy in the community. We ask them whether there are some spiritual resources they need from us. And also we realize that no one heals alone. This is so powerful sometimes. We accompany them. We don't give them answers. We provide them a moment to realize that a good healing or recovery is done in a group. So we do chaplain group in the ATP, homeless program, and PTSD to remind them that if you want to heal, you need to connect. You need to be with the people. You can't do it alone. And also, if you see the last quote I put below there, recovery begins when someone walks with you and reminds you there is still something to be thankful. I know most of us who are attending this summit, we came from a busy moment and we started by slowing down. At least we remind them that, you know what, if you focus so much on the world of abundance, not on the world of anxieties or worries, there's always an opportunities. And eventually they give us a moment. I remember one of the veterans come and say, I heal simply because someone finally listened without judging me. No, that was in the impact we gave on them. So we really help a lot at the VA in the general sense of mental health, not just as the one moral injury, PTSD, but we deal with all the general mental health in this facility. Slide number 2, thank you. So that's right now, the practical part of it, as I mentioned, that gratitude is a moment that brings everything into healing, into perspective. And we do it very simply by asking the individuals who have come to us at least to focus on little things that they are thankful for. And this brings to understanding that, as I mentioned, that sometimes we want only to focus on bigger things, that sometimes leads us to a lot of fear, worries, anxieties. At the end, we are not functioning well. So we remind that if our mind can stop, like the way Chaplain Fiesel told us this morning, to stop a little bit and count some of the moments that you have really done well this morning. It can be little things like the life day to day, you can just find yourself say, what good has happened today for me? What am I thankful for? I'm thankful for being alive. Or one person, I'm thankful today, someone smiled at me, I smiled back. Those are moments that it helped our stakeholders here we care for to realize that life is still worth living. And in that moment, they come to realize, wow, there's the goodness of Chaplain here, because we are focusing so much on giving them hope that there is a way out there. We are focusing so much on letting them know that they don't need to be alone, that we are there to give them help. And that has really helped a lot in a sense that it brought something that collaboration with the other teams. We have received a lot of referrals, a lot of counsel from psychiatrists, because psychiatrists and psychologists have started putting the treatment plan, care for every patient who have come out outpatient mental health to come to Chaplain too. So that has been a very wonderful collaboration here. For instance, one of the patients say, I'm seeing something in the air. And sometimes it reminds me of my dear ones who have died. The psychiatrist say, let you go to talk to Chaplain also, and then I will take on the medical, on the clinic, the mental health perspective. So that collaboration has been so good to see that psychiatrists refer the patient to us, and then we are also asking how best we can help them. So that's the area that I'm talking about. The whole person care has been so wonderful at the level, because every one of us stay on our lane, on the what we call here the chain of command, the chain of relationship, the chain of communication. So every one of us, Chaplain, knows that, yep, this is your spiritual lane, the social worker knows this, and so forth. So that's where the emphasis, the whole person care is important. Of course, gratitude, as I mentioned, that the gratitude is something that is not only for the patient, it's for all of us as we are here. And that's why I'm asking all of us to have that moment, to practice a moment of being grateful. And let us keep it, if you have a pen somewhere, take 20, just think of 3 things or people you are thankful for today. 3 people that you are thankful, or 3 things. Remember, small practices of gratitude can interrupt despair and reconnect us to meaning. So today, as we go, I want all of us to realize the importance Chaplain play in all the activities, the inputs that have been mentioned, the activities we do. But the question comes, what impact, what outcome do we bring at the table? As chaplains, we may not remove every wound, but we can help ensure that no veterans walk through suffering alone. Hope often begins in relationships, one person willing to walk beside another. That's one thing I want you to take today, that we all need somebody who can work with us in the recovery, so that we minimize the professional conflict, but focus on the patient care in their recovery. Thank you.
Thank you so much in really reminding us the power of gratitude. All right, our final spotlight. We are going to hear from the Chaplain Alan from Milwaukee, and he's going to be talking to us about community engagement. So Chaplain Alan, thank you for joining us today.
Thank you. Glad to be here. And thanks to all the chaplains who have went before me, who've done an absolutely amazing job up until this point. So hopefully I can do the same. So I am the Chief of Chaplain Service for the Zablocki VA Medical Center. And in brevity, I want to talk about the internal and external stakeholders and how here at Milwaukee, how we've come to that. So when I was hired 5 years ago, I met with the then deputy director, who is now the medical center director, and I asked him a few questions on what did he want, how, or what was his vision for chaplaincy. And I asked, how do the chaplain service line, what is our footprint in the community, and what is our footprint within the medical center? And he expressed at that time that it could be better in both spaces. So one of the things that I did during my first 3 months here, once we got a PSA, is I had the PSA call every religious house of faith or community organization within a 15 to 20 mile radius. And I asked her to set up meetings with the clergy or community leaders. They could either come in to the VA or I'll go out to their area. This work could not have been done without her. And we scheduled meetings with over 75 to 100 people of faith or community leaders. In that, we held a community symposium, which got all these leaders together, and we had a national representative come in. And through that community symposium, relationships were forged with people of all faiths, all leadership throughout the community, and those from even further north in Wisconsin. And so with that began a beautiful relationship of people who said, hey, can you come to our church, or can you come to our synagogue? Can you come and share more about the VA and veterans and chapel service and moral injury? Because that was a term that was very foreign to a lot of people. And through that, we were able to actually connect with VBA and have someone with VBA from VBA come out with us. And this was done in partnership with our community liaison. We partnered up and went to different events, sharing about suicide prevention and moral injury, and it opened the door to healthcare for so many veterans who were not even registered. So externally, it was that one big event that led to so many different relationships and so many different connections that allowed us to increase our footprint within the community. And now let's talk about internal. Internally, again, we struggled. Chaplain services was one of those service lines that we were called if someone was dying, or we were called if it was a bereavement space, but not for much of anything else. So again, my PSA and I had her connect with all the division leaders and managers, and what we did in the community, we did internally. I went to where they were. I met them. I explained who it is that we are, what we do, as Chaplain Fisher has said, and educated. And through that, built some amazing relationships that led to various programs. And I've highlighted just a few. A partnership with pre-surgery. Pre-surgery was having challenges, having phone calls to talk about advanced directives with patients and family. Due to the relationships that was built, I said, hey, let chaplain service assist in there. We did, and that became a best practice throughout the VISN. And chaplains were able to call and have amazing conversations. And veterans that have had surgery for 6 or 7 or 8 surgeries, it was the 9th surgery that they had pause about. And it was the chaplain who was able to connect with them and also connect with healthcare members or physicians to let them know, hey, this is what's going on with the veteran. So it was some amazing relationships built by just going knocking on doors and explaining this is how we can help. That also rang true in our domiciliary. We have a 125 bed domiciliary here, and there were some challenges with rec therapy. Again, I met with leadership and said, can chaplain service come in and do a spirituality activity on Sundays where recreation therapy was having some challenges with staffing? Leadership said absolutely. Through those activities, the camaraderie and the veterans just sharing over a game of cards or a game of pool was absolutely phenomenal. It increased not only people coming to the chapel and making spirituality a part of their treatment, but it went widespread and continues to be something that has been beneficial within the DOM. And then the last two is the empathy training, which that also is connected with mental health. I had the opportunity to work with Dr. McBride, who allowed chaplain service to come in and share with moral injury. And the empathy training pairs veterans with residents, physician residents finishing their training, and it allows them to say what or why caring for a veteran may be very different. And chaplain service was infused in that to share with moral injury and to share in other aspects of what the other chaplain said, staff care, because physicians and all of the medical staff go through challenges of life itself, but challenges even with giving patients bad news. And sometimes they need space to decompress. So we were able to say, hey, we're here for you. And then lastly, due to those internal stakeholder and relationship building, chaplain service was able to be part of our NEO, new employee orientation, as well as new managers orientation. And one thing that I'm extremely proud of is we have nurse resident shadow chaplains and also physician shadow chaplains. And the sentiments or the comments that's always made, I never knew you all did that much. I never knew that you could do this, or how veterans share with you more than that they share with any of us. So those are just a couple things that we were able to do in regards to internal and external stakeholders. Thank you for listening, and back to you, Megan.
Wonderful. Thank you so much. It's so important to consider our communities in every angle. So here's what we're going to do. There's less than 2 minutes left. So I want to very heartfeltly thank their chaplains for giving their time and their expertise, local recovery coordinators for supporting this whole summit and developing this. And I really appreciate everyone on this call. I mean this, that your presence is really part of how we promote hope and healing for veterans, not just in words, but in practice. Showing up for each other is like part of this mental health awareness thing. So thank you so much for being here. Please, if today sparked an idea, a question, a partnership, don't let it stop here. Reach out to your local chaplain. They're wonderful, hardworking people who care about recovery. Reach out to your local recovery coordinator. Keep the conversations going. So if you did drop a question in the chat, I'm sorry we don't have time to get to them, but please don't let it stop there. Reach out because those connections is what makes recovery happen and what makes us the strongest community to serve veterans. So thank you for that. Please look out for an email for an opportunity to provide feedback as well as resources. You'll have the chaplain resources as well as some other ones. And we so appreciate your time and spending the morning with us to focus on chaplain and veteran mental health recovery. So thank you so much, and please take care of yourselves.